Okay, moving on to issue number 3, again, with the Senate Dems plan of Build Back Boldly and making sure that we really take care of those in our safety net. This is another one of those issues that we spent quite a bit of time talking about our IDD community and the tremendous impact that COVID has presented to them, but also the historical lack of funding and I mean, sometimes we don't always care for those who may need more care. So some of the issues that we heard about the reimbursement rates and pays for our providers. We want to get rid of those suspensions where people aren't paid or required to work on holidays, taking away people's holidays. The ability for people to be able to have virtual meetings, incredibly important, and keep that open. Also to be able to provide clients and their families with more resources that they can self-direct. And then finally, providing pathways for this caregiver community to be able to engage in even more skill training to create a real skill pathway going forward so people can continue to provide this important care, but to grow and develop so that they can take care of their own families at the same time. So we think these things are very important, and we have a panel here to also talk some more about this. And Jordan Lindsey, the Executive Director of the ARC of California.
Thank you, Madam Chair. It's an honor to be with you today and the senators of the committee. My name is Jordan Lindsey. I'm Executive Director of the ARC and United Cerebral Palsy California Collaboration. I've been asked to speak on the challenges of the workforce in developmental services, the direct support professionals, DSPs. So just a little bit of background. A direct support professional, DSP, is someone who works directly with people who have intellectual or developmental disabilities. DSPs, they aim to assist people in realizing their full potential. They help people become integrated and engaged in their community. In the past, DSPs were trained as caregivers, but over the past few decades, the needs of those being served has definitely changed. The roles of a DSP has changed. Now, DSPs take on different aspects and roles other than just caregiving. It is no longer about doing things for people, but rather it's about supporting the individual to learn how to reach their potential and do things for themselves. Throughout the field of developmental disabilities in California, the role of DSPs is to provide support, which is different than caregiving. A caregiver will do something for someone like pick out groceries. In contrast, DSP will work with someone to enable them to do things independently, to choose their own groceries. In this way, DSPs teach people how to do things independently, and the skills required for quality services from a DSP go far beyond assistance with daily living. A DSP must also be a job coach, a community integrator, an administrative assistant, an observer of healthcare changes, a behavior specialist. John F. Kennedy Jr. stated that quality is defined at the point of interaction between the staff member and the individual with the disability. And so that's what I'm here to talk about today, is how do we increase that quality and how do we make sure we are respecting and giving commitment to the DSP workforce. I can honestly say it was the best job I've ever had, 3 years as a DSP. It's incredible work. So quickly, who are the DSPs in California? We estimate there are about 100,000 DSPs. 82% are women, 62% are non-white, 27% are single parents. This part is tragic. 34% must work 20 plus hours at a second job. 34% must work 20 plus hours at a second job. And 36% are on Medi-Cal themselves. Through the COVID pandemic, we have seen DSPs become heroes. They were already heroes, and now we are recognizing that for their response during the pandemic, sacrificing so much of themselves, their safety, to make sure that they continue to support individuals with disabilities throughout the pandemic. It has truly been inspiring to see how DSPs have responded and have acted so heroically during the pandemic. But there is a problem. For all that we expect of DSPs, for how much we need DSPs, we don't respect DSPs. And this is evident by a 50% turnover rate in our system of direct support professionals. The state of California does not recognize DSPs. We do not offer a certification We do not provide comprehensive training, and we certainly do not provide and pay fair wages. For the heroism they have displayed and for their ongoing support of Californians with IDD, we barely pay DSPs minimum wage. These low wages are a result of the low rates the state pays providers. Low wages is one of the problems, but the lack of a clear career path is another. And because of these problems, the impacts on individuals and families can be disastrous. As a real life example, it is not uncommon for the past president of our board of directors to go through 4, 5, or 6 DSPs in 1 year for her adult son. How is that quality? Is California content with that? That's the question we must ask ourselves. Instead, I believe now is the time to tell this critical workforce that we see you, we respect you, and starting now, we're going to enable you to better support the clients that you are so passionate about. The ARC and UCP California Collaboration, along with the many members of the Lanterman Coalition, propose that we do so by the following. 1, create a certification for DSPs that includes best practices training and ongoing education. As the members of this committee are well aware, there is obviously precedent in this state for a certification. For example, certified nurse assistants, CNAs, certified home health aides. Additionally, the DDS rate study also suggested creating something similar to this, a tiered DSP certification process, such as a DSP 1, 2, and 3 based on your training. There already exist training modules that are used nationally. There are local ad hoc certifications that have been developed to try to fill this void. So this can be done. It'll take work, such as finalizing a curriculum, but it can be done and should be done, and we should act boldly to do so. Number 2 proposal related to this is tie the certification to increased wages. This creates the incentive for better quality and outcomes, as well as begin to pay a more livable wage to our DSPs. This has already been explored in many other states and enacted in some. As an example, the state of Indiana, they increase wages by $3.50 an hour for DSPs who complete the certified training. These increased wages can easily be achieved by following some of the recommendations in the DDS rate study to pay fair rates. And the third and final proposal related to this is provide funding for the training and the certification for service providers to provide this training to their employees. It takes time and money for individuals to complete these trainings. For example, a CNA in California is 100 hours. So we must include funding not only for the wage increases for the certification, but also for the initial training for individuals to do that and to complete those 100 hours or however many hours it may be for a DSP certification. Creating this career path for DSPs is far from the only proposal we are pushing this year for developmental services. We have a number of proposals, including a $650 million proposal for the use of the one-time American Rescue Plan funds and regular ongoing budget proposals, such as in the agenda of the elimination of the suspensions. And those proposals are certainly bold and will build back boldly, the developmental services in California. And we strongly encourage the committee to give attention to all those proposals and certainly our need to recognize the heroic efforts of DSPs in our COVID response and also our commitment to them as we build back in the future. Thank you for the opportunity to speak on this subject.
Thank you very much, Mr. Lindsey. Yeah, I think we heard loud and clear when we covered this a couple months ago, and I think we all, hopefully we have responded with kind, and these proposals have been good, and we are, for once and for all, hopefully really going to get folks on a path. When you talk about 50% turnover rate, I mean, you can imagine if people are making less than minimum wage, working long hours in the state of California, they're also struggling with homelessness themselves and affordability and food security. And if you don't have enough training to be able to do your job or feel like you're making a difference, then the burnout is even higher. So, you know, we can talk a lot about our values of caring for those most vulnerable, but a proposal like this takes care of the people that we're trying to serve, as well as those caregivers and families, and it just helps the whole system. So we are excited to be able to finally have some funding to be able to work on some issues like this. Dr. Pan?
No, thank you, Chair Eggman. I would just appreciate, again, our proposals we're moving forward, especially we've talked a lot this year, but we've talked every year about especially the funding suspensions being left in place. And while they don't affect the immediate budget, of course, that keeps Health and Human Services, including developmental services, on the chopping block during downturns as well. So, and certainly it's other measures. I guess I would also just point out that I'm certainly proud that here in the Senate, in our budget proposals, and budgets are challenging because they all have to be balanced, and I think it's usually we're usually the ones taking the steps to try to expand and increase support and services for people in the DD community beyond what usually is proposed initially. So I hope that there's some recognition. We could, I think there's always a desire that we could try to do more, but that certainly here in the Senate, we've tried very hard to continue to not just simply accept what's proposed, but continue to push to increase funding and to increase support for caregivers and the DD community. Thank you.